Well, great. Thank you all for coming. And I want to talk about an opportunity that we just launched a new franchise for Holtorf Medical Group. And really, the challenge for a lot of anti-aging physicians, you go through all this training, and it's kind of like where you think you're able to treat the patients, but really, how do you actually do it? And how do you market and drive patients to your office? So we've really developed a turnkey practice, a turnkey system for you to do that, which includes all the training, all the marketing, ongoing training, and also supplements and things below wholesale costs. There's other franchises out there. We're a little different in that you're able to keep the majority of all your income. And a lot of these other franchises will basically, you give all your income for supplements, medications, and you lose that residual income. So this is an opportunity to actually keep that income and a much higher potential income with the system. So we'll talk about that. Okay, so again, we offer a complete turnkey, non-insurance-based franchise practice. Includes everything you need to be a successful practice. Well, we're going to talk about background. I'll give an overview video. We'll have a couple videos during the talk. We'll talk about insurance medicine, which everyone, I think, is clear is not the way to go, especially with healthcare reform. It's only going to get worse. How to be a successful cash practice. We'll talk about training. We'll do a franchise video which talks about the franchise itself. Marketing program. We'll give some media clips. Call center. We'll talk about supplements, medications, in-house testing. We'll talk about financials, which of course is very important. We'll talk about what's the benefits of a franchise. Legal, we'll spend a little bit of time on legal. I think there's some misinformation that's been given out there about legalities of franchise and there are a lot of legal issues with both franchise and medical centers, fee splitting, corporate practice of medicine. We'll briefly talk about those because those are very important. There's been some misinformation about that. And we'll talk about getting started. So just a little bit of a brief background. Started the Holtorf Medical Group 10 years ago in Torrance, California. We're a cash practice from day one. We're a leader in innovative treatments for age-related hormone deficiencies of bioidentical hormones, thyroid dysfunction, complex endocrine dysfunction, fibromyalgia, chronic fatigue syndrome, infectious diseases, and age management medicine with patients traveling across the country, across the world for treatment. We get about probably 10-15% of our patients from other countries, Canada, England, Australia. Patients travel from across the country as well. And we're a little different in that we certainly do bioidentical hormones, age management medicine, but just so you know, there's a lot of competition in that. You look at all these doctors coming out, they're dabbling in bioidentical hormones, and so you really need to be better. You need to do things a little differently, be able to treat the sickest patients, and a lot of fatigue, chronic fatigue syndrome. These conditions are exploding, but they're being poorly treated, certainly in the standard medical model, but also in just doctors that are just sticking with, okay, here you go, let's do the testing beforehand, give a little bioidentical hormones, and a little bit of thyroid. So that's going to get a few people better, but the majority are not. So you really need to be able to treat those patients because that's the patients that are looking for a doctor. Our current revenues currently are over $9 million a year in our one center, and we just launched the second center, the first franchise, which is corporate owned, but as our first model. Currently we have 4 doctors and 1 nurse practitioner in our Torrance office. I'm going to speak rather quickly because it's about an hour and 15-minute presentation we've got to do in 45 minutes. Opened up the second center again in Foster City, which is right near San Francisco. In 2008, we had the second doctor 11 months later. I founded the Fibromyalgia Fatigue Center in 2003, was the medical director there. So 15 centers across the country, developed all the treatment protocols, responsible for all the initial and ongoing training of physicians, which is really a multi-system treatment. And that's the difference. So, right now I think a lot of doctors, they're doing a little nutrition, a little bit of hormonal therapies, but you really look at, all these infectious disease, very important, advanced hormone therapies, as well as mitochondrial dysfunction, of course, GI, nutritional deficiencies, coagulation deficiency, heparin, great treatment for these patients, life-changing. We opened 12 centers initially and then 15 centers across the country for the fibromyalgia fatigue centers. So I'm board certified and board examiner for A4M, speak in the fellowship program regarding bioidentical hormones. Published a couple peer review endocrine reviews, the bioidentical hormone debate, which is in postgraduate medicine. Really, all these doctors, as you know, say the standard doctors, there's no studies. Well, there's 200 studies all showing bioidentical hormones are safer than standard therapies. All these are available at our booth if you want to come by. Hormones and wellness and disease prevention, common practices. So that talks about aging, anti-aging hormones, including estrogen, progesterone, testosterone, growth hormone, and thyroid. And also diagnosis and treatment of hypothalamic pituitary adrenal axis dysfunction in patients with chronic fatigue syndrome and fibromyalgia. That was in Journal of Chronic Fatigue Syndrome in 2008. Really shows that 90% of patients with those illnesses are low adrenal function. But standard blood tests, or really even stimulation tests, ACTH stimulation tests, no better than flipping a coin. So it tells how to treat that, diagnose and treat that. Founded the nonprofit National Academy of Hypothyroidism. And I did this site. It's relatively new, but there's so many good sites out there showing that, hey, standard blood tests aren't reliable for thyroid, but there's really not a lot of good evidence behind it. So this is the first two articles. One has 200 references, the other one 300 references, all showing that TSH is not reliable. Talks about conversion, deiodinases. So really evidence-based thyroid dysfunction. Co-founder of the nonprofit Biomedical Hormone Initiative with David Brownstein and Erica Schwartz. I'm also a reviewer for the journal Endocrine. So I'll just start out with a little 7-minute video about the practice. I think will give you a lot better feel for what we actually do and again, the type of patients that we see in the field for the practice.